Yeah, okay. So, wash my hands. Hello, good afternoon. My name's Dave and I'm one of the junior doctors. I've been asked if I can examine your hip today. Is that okay?
That's fine, yeah.
Do you mind if I just confirm your details before we start?
My name's Stephen Byrne and my date of birth is 19th of December 1995.
Excellent. So what the exam is going to involve today is I'm going to ask you to walk up and down, I'm going to have a look, I'm going to have a feel of the joints in question, and then we're going to have a move of them. Is that okay?
That's fine.
Excellent. So first things first, would you like to stand up for me?
Yeah.
Excellent. And I'd just like to do a few walking laps up and down, if that's okay. Perfect. You're right to finish there for us. And you're right to just take a step forward, so you're just away from the camera. Brilliant. So what we're going to do now is I'm going to do something that's called Trendelenburg's test. It's going to involve me putting my hands on the pelvis, if that's okay. Is that all right? Mm-hmm. So I'm going to ask you to go onto one leg. So if you feel unsteady at any time, just hover your hands over my arms and you can grab me to stabilise if you need. Is that okay? Mm-hmm. Excellent. All right. So just going to feel for what's called the anterior superior iliac spines, which you've got there. So if you could just take your right leg back for me. So you're just on your left. Perfect. That's it. Let's just stabilise there. All right. There we go. And you can put that leg down now for me. And then just hover those hands above my arms if you need. And then can you do the same with the left and bring it back? Perfect. Thank you very much. Okie doke. Are you right to just have a lie on the couch for me? So I'm just going to have a wee look at the joints now, if that's okay. Any pain anywhere? No. No. Okie doke. All right. So I'm just going to have a look. Ideally, in a sort of clinical scenario, the patient would be down to their underwear, but for patient dignity on this occasion, we're just going to keep your shorts on. So we can sort of round the joints. And then I'm going to just take my tape measure and I'm going to just measure your legs, if that's okay. You have to put your arms down side. So I'm just going to start from the umbilicus to start with. Measure the medial malleolus. Okay. And that's 67. And then we're going to do the same on the opposite side. So that's apparent leg length. And then we're going to do true leg length. We're going from the iliac to the medial malleolus. And the same on the opposite side. So they're both equal. Okay, thank you very much. So, look, I'm just going to have a feel of the joints now, just to see if there's any temperature difference. Any pain here when I palpate at all? No? Excellent. Okay, so now we're going to do a few movements. Okay. So, in an OSCE scenario, I'm going to ask the examiner if it's okay if I combine Thomas's test with test of flexion, just to make the exam more slick. And then depending on their answer, we'll proceed. But on this occasion, we're going to combine the two. So what I'm going to do is, I'm going to put my hand behind your lower back, like so. And what I'd like you to do is, I'd like you to press your lower back into my hand, okay? And then I'd like you to take this knee and bring it up as close to your chest as you can. Excellent. So we've got a good range of flexion here, and we're also looking to see whether the contralateral limb is raised off the bed. Okay, you can put that leg down. And then do the same with the opposite leg. Again, looking at the degree of flexion and also the contralateral limb. Okay, that's fine, relax. So now I'm going to check for internal and external rotation whilst looking at the patient's face, just to check for any pain. Okay, so we're going to do external rotation and internal rotation. Any pain there at all, Stephen? No pain. Okie doke. Now we're going to do the same on the opposite side, internal rotation and external rotation. Any pain at all? No pain. Excellent. Okay, so for the next set, we're going to examine your hip abduction and adduction. So what it's going to involve is me resting a hand over your pelvis like that. Is that okay? Yeah. Excellent. Okay. So let me take the weight of this limb. I'm just going to feel for pelvic tilt, and once it starts to tilt, I know that that's no longer hip movement and that's pelvic. And there we go. And I'm going to do the opposite side too. Excellent. Okay. And then ordinarily there'll be a couch where we could do it on the opposite side. Okie doke. Any pain there at all? No pain. Excellent. Okay. And that depends on the way your med school's been taught you how to do this, whether we're going to do extension or not, but we'll demonstrate how to do it anyway. Are you alright to flip over onto your tummy, Stephen, so you're prone? Yeah. Lovely. And then we're just going to check hip extension. Okay, let me take your weight. And there we go. Any pain there? No. Good. And same on this side. Any pain?
No.
Excellent. All right. So you're right to go back onto your back for me. Excellent. So we're just going to do a quick screening neurovascular assessment. Okay. So let me know if you can feel them touching you. Feel them? Yeah.
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 Does it feel the same on both sides?
It does, yeah.
Excellent. And then we're going to feel palpate for the pedal pulses, which we can feel. And then general sciatic nerve function test. Can you push your toes against my hand? There we go. Perfect. Okay. So that completes my examination. Thank you very much for your time today, Stephen.
Thank you very much.
Just going to wash my hands. So now what I would say is to summarise my findings. So on this occasion, I've examined Stephen today, and we found that he's got normal range of movement and an absence of pain or movement of his hips, and his neurovascular screening of his lower limb was normal. But to complete my examination, what I would do is I would examine the limb above, or excuse me, the joints above and below. So it'd be the lumbar spine and the knee. In this occasion, I do a full neurological and vascular assessment of the lower limb. And for some preliminary investigations, I would order some plain film radiographs of the hip. Okay, thank you very much.
Thank you.